Hi, my name is Amanda Law Pedro, and I would be doing a video presentation on atypical development, and the topic area that I have chosen is dyspraxia. Let's take a closer look at dyspraxia. I would like to give a more in-depth look at dyspraxia, the signs, how we can diagnose it globally, how it is diagnosed in Trinidad, how to treat it, two ways a teacher can assist with early intervention, the long-term effects of such, and what I have learned and what I recommend. Dyspraxia is an atypical behavior, which is a behavior that falls out of the norm. Dyspraxia disturbs sensory motor performance, and there are symptoms we should pay attention to. However, it is important to note that dyspraxia cannot be cured. There are several signs of dyspraxia. One is clumsiness, speech problems, fatigue, poor balance, poor hand-eye coordination, poor posture, and perception problems. Global diagnosis of dyspraxia. First, we have to be sure that these signs are present. Then a parent or the client should visit their general practitioner. They should also see their health visitor, and they should also visit a special educational need coordinator. They will then refer you to the professional. These professionals are the pediatric occupational therapist, pediatric physiotherapist, clinical psychologist, educational psychologist, and a mental health service clinician. When being diagnosed, the child must have a norm reference, where professionals can compare and contrast their behaviors. They will be tested on motor abilities. Occupational therapists and pediatricians will carry out these tests. They will also be tested on the motor ABC test. This test basically tests their gross and fine motor skills. It should be noted that the norm reference must be the same age as the dyspraxic child. How is dyspraxia diagnosed in Trinidad? In Trinidad, there is the Morris Center, Unlocking Learning Potential. There are two phases of assessment. Phase 1, Neurodevelopmental Evaluation, which evaluates the strengths and weaknesses in language, vision, learning, fine and gross motor skills, and attention ability. They are to determine if the disorder is attention or focus exists. They use background information, questionnaires, diagnostic interviews, and evaluation on attention and behavior. After phase 1 data gathering has occurred, we have diagnostic staffing, where professionals gather to discuss phase, then it is followed by an interpretive meeting. This is where They will meet with clients to determine if phase 2 is recommended. Phase 2. Phase 2 uses tests to compare child across a nationwide sample of the same age peers. These tests include cognitive, academic, speech and language, and sensory processing. How can dyspraxia be treated? Occupational therapy. Occupational therapy basically means evaluating everyday functions, teaching a child how to manage home, play, chores, and school. Speech and language therapy. This is basically teaching the child how to speak and how to communicate more efficiently. Perceptual motor training. The child is learning language, visual, movement, auditory, and it's progressively difficult but not too stressful. E-choir therapy. And you guessed it is horseback riding, which improves cognition, mood, and gait performance. We have lastly active play. And active play is vital for motor abilities for improvement. 2 forms of early intervention that a teacher can attempt. You can try to pay attention to writing utensils. Don't use slim pencils, but thicker ones or ones with grip for better control. Use graph paper to assist with spacing and placing of letters. Another intervention teachers can use. They should adjust seating plans. It is important that children with dyspraxia focus and pay attention. So seating them at the front of the classroom may be vital, since they will have less distraction in the hallway, looking at charts, being distracted by other peers. Long-term effects of intervention. They will experience less problems with acceptance by their peers, higher self-esteem, a lesser chance of depression, communicate better, and better motor ability. Conclusion and recommendation. In comparing and contrasting the difference between the diagnosis in Trinidad and in comparison to the world, I would say that Trinidad's Morris Center has done an exceptional job in diagnosing dyspraxia. Dyspraxia is not a mental disorder, but a disorder that can be treated even though not cured. Early interventions are vital to the future of these children. Teachers should definitely assist in early interventions of dyspraxia. Dyspraxia and other learning disorders can be very taxing financially for some parents. I recommend the government of our Caribbean countries to play a more economic role in funding more centers to assist these children. I also recommend that the public be more aware of these learning disorders and be understanding of the people who suffer with dyspraxia or any learning disorder. I hope that this video was edifying to you, that you may have learned new things. Thank you for viewing.